Tonight, we're opening 7 real medical case files that sound impossible until you see what clinicians documented. No gore, no shock for shock, and no miracle cures. Just evidence. What happened, what doctors observed, and what science can and can't explain. Stay to the end, because the final case doesn't look bizarre at first, and that's what makes it terrifying. Quick rules. We separate confirmed observation from speculation, and we do not give medical advice. These are documented syndromes and published case literature, presented like an investigation. If you hear a claim, it will be tied to what clinicians can actually observe, measure, or repeat. Now, File 01. Fibrodysplasia ossificans progressiva, FOP, is a rare genetic disorder where soft tissues can progressively turn into bone, restricting motion over time. The key horror is not pain on camera, it's permanence. Once that bone forms, movement can be lost. Even minor trauma can trigger flare-ups, which is why early mismanagement can worsen outcomes. This is biology building the wrong material in the wrong place. CIPA, congenital insensitivity to pain with anhidrosis, removes 2 critical protections: pain sensation and normal sweating. Without pain, injuries can go unnoticed. Without sweating, overheating becomes dangerous. The bizarre part is the absence of symptoms that normally save lives. Here, the missing signal is the threat. Alien hand syndrome can make a limb move with apparently purposeful actions the person didn't intend. It's linked to specific brain lesions or disruptions in networks that coordinate intention and movement. The body isn't possessed, control circuits are misfiring. The fear comes from a simple fracture: action and ownership separate. Foreign accent syndrome is when speech changes so listeners perceive a different accent, even though the person never learned it. Small shifts in rhythm, timing, and articulation can sound foreign to others. Many cases are associated with neurological injury affecting speech motor planning. The unsettling part is identity. You sound like someone else without choosing it. Cotard syndrome involves nihilistic delusions. Some patients believe they are dead, missing organs, or no longer exist. Clinically, it can lead to severe refusal behaviors because the brain's model of the self collapses. This isn't metaphor or poetry, it's documented psychopathology. It shows how reality can fail from the inside. In some severe epilepsy cases, surgeons cut the corpus callosum to reduce seizure spread. Split brain research then showed that the hemispheres can process information differently when crosstalk is limited. It's not 2 people in one body, more like one brain running with reduced data sharing between major processors. These cases made consciousness research measurable. Fatal familial insomnia is a rare inherited prion disease where sleep regulation progressively collapses along with neurological function. This isn't normal insomnia. It's neurodegeneration affecting fundamental brain systems. The reason it's terrifying is not drama. It's trajectory, worsening, systemic, and relentlessly disruptive. It shows how a single protein problem can dismantle something as basic as sleep. These cases aren't supernatural. They're biology at the edge, genes, proteins, and circuits behaving in rare ways. What feels impossible is often just unfamiliar. Medicine advances by documenting the exceptions and turning them into patterns. That's why case files matter. They teach recognition. Some mechanisms are well described, others are still debated. The honest line is this: observation is strongest, explanations vary, and treatments are not the point of this video. We're mapping what's documented and what remains uncertain. Mystery doesn't mean fake. It means incomplete. If you feel your brain resisting these stories, that's normal. These cases attack assumptions. Pain is protection, control is guaranteed, identity is stable, sleep is automatic. Medicine proves those assumptions can fail. And when they fail, the results look unreal until they're measured. The most unbelievable part isn't the symptom. It's that these are recorded, peer-reviewed, and repeatable categories of human biology. Not stories, documents. You don't have to believe them. You have to accept that the record exists. That's the difference between myth and case file. Quick note: educational documentary only, not medical advice. If you're worried about symptoms, talk to a licensed professional. Our job is evidence, not diagnosis. If you want more evidence-first mysteries, medicine, science, history, and anomalies, subscribe and join the investigation. New videos every day.